Good morning, and welcome to the College of Public Health's Awards and Recognition Ceremony today. I am Paula Arnett, and I'm currently the Interim Associate Dean for Academics and Student Affairs. It is my honor to welcome you to this special day in the life of our college as we recognize our students for their excellence in scholarship, leadership, research, and service. We will also be honoring our outstanding teachers among our faculty. But first, we will celebrate the induction of new members to our honor societies. With that in mind, and with no further ado, I would like to welcome to the stage our keynote speaker and Delta Omega honoree for 2019, Ben Chandler. Mr. Chandler has been president and CEO of the Foundation for Healthy Kentucky since 2016. Leading the foundation, he helped bring about when, as Kentucky Attorney General, he won a $45 million settlement from one of Kentucky's largest insurance companies. He has also served as Kentucky State Auditor and in the U.S. House of Representatives for Kentucky's 6th Congressional District, an 8th-generation native of Woodford County and a 2-time graduate of the University of Kentucky. Today, Mr. Chandler is extremely active in promoting the health of Kentuckians. He also serves on the College of Public Health's Dean's National Advisory Board.
Thank you, Paula. Very nice to be with you all today. I was concerned there for a minute that you weren't going to mention to everybody that I graduated from this university twice. I'm very proud of that fact, but I have to tell you, you all might get a kick out of this. It took me 9 years. I was on this campus for 9 years in order to get those 2 degrees, but it just goes to show you how much I loved it here. A wonderful place, the university, and every time I come back, I'm just floored by all the changes. Believe me, when I went here, it did not look like this at all. Anyway, I am most pleased to be receiving an award today. I had not expected to get a public health award, but I'm very honored to be a member of Delta Omega. As with all honorary societies, I know that the goal of the membership is to encourage further excellence and devotion to public health work. And you have my word that I will endeavor in the rest of my career to meet that challenge as I continue the work that I'm doing now at the Foundation for a Healthy Kentucky. And I want to spend a little of my time here to just give you some idea about the foundation and what it does. We are a nonprofit, nonpartisan, and let me tell you, being nonpartisan is a right good place to be these days. There are very few people in that space at the moment, and I haven't always been in that space. Although, just an aside, in my years in politics, I was what was referred to as a moderate. It's sort of like a dinosaur, you know. There are not many of those around anymore, and there are not many around because nobody likes them. The people on the right don't like them, and the people on the left don't like them. And because they don't think they stand for anything. And I said, what are you talking about? We stand, and I stand, for our country. I stand for the government working properly on behalf of its citizens. What on earth is wrong with that? And please tell me what's wrong with a little compromise. And that's what we don't see hardly at all anymore. We don't see compromise. Nobody's willing to compromise because the bases on both sides won't allow it. You don't have to go much further than Pavlov to understand that. You know, you compromise and then you get hit in the head with a 2x4 as a result of compromise. It has a chilling effect on doing it again, I can tell you. And that's what happened. As I used to say, I'm always constantly on the lookout for the radical middle. Well, I'm still looking. There isn't any radical middle. But in any event, all that's over. I get to be nonpartisan now. And it is a wonderful place to be. I'm over here with some of these public health people who've been around the university poobahs over here. And Yeah, that's right. That's at that far table over there. Anyway, the university poobahs, they always get to be nonpartisan, and I've always been jealous of it. And now with the foundation, I'm in that space, and that's good. And we only have at the foundation, we've got one purpose: improving the health of our people in the Commonwealth of Kentucky. That's it. That's all we're trying to do, and everything that we are attempting. As of March, at the end of March, we had given away nearly $28 million in grants to various organizations for demonstration projects and policy advocacy at the foundation. And the foundation is largely focused on policy advocacy through coalition building, convening, and research. We also conduct the Kentucky Health Issues Poll and other research to try to move our policy efforts forward. The foundation's focus areas this year, in fact, in the next 2 years, we have 4 focus areas. One is tobacco use reduction. One is obesity prevention. Access to health care is the third, and adverse childhood experiences the fourth. Now, as you can see, that's not an exhaustive list of all the difficulties that we've got in public health and health generally, but we had to pick and choose, and we go through a process with our board. And the reason that we ended up with those is because we felt like we could actually have an impact in those 4 areas. And we're a small foundation. We've got now, well, we started with $45 million. We've now got close to $55 million, and we've given out $28 million along the way. I love that math, really good math. But we've got, that makes us a small foundation, not a large foundation. It means that we've only got a couple $1 million every year living off the income to give away statewide. And in a state with almost 4.5 million people, that's just not going to go a long way when you're giving grants out, at least not a long way toward improving the health of the citizenry generally. So we've been looking for ways to punch above our weight. That's what we want to try to do, have the biggest impact that we can have, and we believe it's in the area of policy. We believe that if you make changes and make advances in the area of policy, you're going to have a whole lot more impact than you are if you're just giving grants out. While the grants are great and they do good things, it's the policy work that allows you to punch above your weight. And I'd like to focus today on the importance of local and state policy work. And I'm going to share some examples from our work in these areas. Again, I'm going to talk about it, and we're moving in that way because we believe we get the biggest bang for our buck in terms of improving public health through policy advocacy. I'm going to start with our tobacco reduction policy advocacy that we've been involved in. As public health students, you may be aware of the kinds of state and local measures that reduce the rates of smoking and other tobacco use. Among the most well-researched and effective measures are, first, raising the price of tobacco products, and second, enacting smoke-free workplace policies. A third one is making K through 12 school campuses tobacco-free 24/7. And a fourth one is raising the legal age to access tobacco products from 18 to 21. Well, these are all policies that have been shown to reduce tobacco use. They're the measures that we know work. And there's something else about those measures. And one of the reasons we decided as a foundation to focus on them, they don't cost anything. You don't have to come up with huge amounts of money like you do on so many other public health measures. These can be done really at no cost whatsoever. It ought to be what we would call low-hanging fruit. But in Kentucky, It's not. Because you know what, the famous quote, I don't think he even really said it, but the famous quote by Mark Twain, everything happens 20 years later in Kentucky, and that's why he wanted to be here when the world ended, because he knew that it would happen 20 years later in Kentucky. Anyway, we also, and one of the reasons is that we tend to be behind is we're saddled with preemption laws, and that applies to these tobacco measures. The preemption laws mean that most of these tobacco policies that I just mentioned can only be enacted at the statewide level. They can't be enacted locally. And that means that local jurisdictions can only adopt things like smoke-free workplace and tobacco-free schools laws. They can do that locally, but if they want to go and raise tobacco taxes, they cannot do that locally. Or if they want to raise the legal age to purchase tobacco, they can't do that locally either. Those do have to be done at the statewide level, which means that local jurisdictions who might be ready to adopt more effective measures are just simply going to have to wait until the rest of the state catches up. And that can be frustrating. Several times in Kentucky, health advocates have tried to adopt a statewide smoke-free law and statewide tobacco-free schools laws. And I can tell you it's been a rough road. I'm not going to tell you all the reasons, but it starts with our tobacco history, our culture, and the fact that we've got a quarter of our population that still smokes. So it's a very difficult political issue. Well, this year, the Foundation for a Healthy Kentucky and our Coalition for a Smoke-Free Tomorrow launched another campaign to enact a statewide tobacco-free schools law. It was the third major attempt that had taken place, and we decided to prioritize this effort in 2019 for a few reasons. First, we felt like we'd reached a tipping point where nearly half of Kentucky's public school districts had already adopted tobacco-free policies. Their success in the absence of any significant implementation and enforcement issues led the School Boards Association and the Association of State Superintendents to sign on to the effort and sign on to the bill. They had not been in favor of it before. So that was a significant development. Additionally, as I'm sure you all are well aware, we are in the middle of a teen vaping epidemic. In 2018, 1 in 5 high school students and 1 in 20 middle schoolers used e-cigarettes. This explosion in youth vaping has erased years of decline in youth tobacco use. Well, I'm happy to report that the third time was a charm, because the General Assembly finally passed the bill March 28th, and Governor Bevins signed it on April 9th. That means that as many as 275,000 more Kentucky kids will be protected from tobacco products at school, including vaping products, which are within that definition. And that's what I mean about bang for your buck in health policy. 90% of tobacco use starts before age 21. So this policy can have a big impact in reducing youth tobacco use and ultimately the adult smoking rates in Kentucky. By the way, did I mention we lead the nation in cancer? Of course, you all already know that, but it's just appalling. And it screams out for us to do something like this. One of the important lessons from our successful campaign is that it takes a very broad coalition of members and a willingness to work together to achieve success. Our coalition included more than 200 members from public health and health advocacy, from education, from business, faith-based groups, and healthcare providers and payors. It wasn't a perfect law. We've still got an opt-out clause, and we've got to go all over the state and make sure nobody opts out if we can. But I can tell you, we're still very proud. We're very proud of the success and the effort, and it will lead to fewer smokers. Guaranteed. The Foundation for a Healthy Kentucky also has worked to grow and strengthen diverse coalitions to promote childhood obesity prevention policies. I don't know if you all have seen some of the recent information that suggests, the research that suggests that obesity is now becoming the major cause of cancer, even more than tobacco use. Anyway, obviously it's something we need to work on in our society. We recently closed a strategic initiative called Investing in Kentucky's Future, or IKF, under which we provided funding, training, and technical assistance to coalitions in 6 communities around Kentucky focused on preventing childhood obesity. A 7th coalition under this initiative is addressing adverse childhood experiences, and I'll talk about that in just a minute. The Foundation selected grantees for this initiative based on the presence of a cross-sector collaboration of civic leaders committed to improving the health of their particular communities. The initiative achieved many of our goals, including the enactment of 38 policies at the county, city, and organizational levels. The policies local coalitions were successful in getting passed included things like expanding school PE time, healthier school foods, healthier park concession foods, and complete streets policies, so that streets can be used by not just cars, but also by walkers, joggers, and bicyclists. These policy changes mean that the work of IKF coalitions will last long beyond the 5-year grant that we provided. As I mentioned earlier, the 7th coalition under the Foundation's IKF initiative focused on addressing ACEs, the traumatic experiences that produce toxic stress for children. Nearly 20 years of research demonstrates that ACEs directly correlate with negative health outcomes in adulthood. For example, kids who experience more ACEs also have more heart disease, more obesity, more diabetes, and the list goes on. Among the policy success for our Bounce Coalition, which was our ACEs grantee based in Louisville, there's a city ordinance that requires that ACEs training is required for the certification of out-of-school time youth care workers. As a result of this policy change, the benefits of ACEs demonstration programs that we funded will extend to thousands of children throughout the state's largest county. I would add that in both the obesity prevention effort and the ACEs efforts, we're developing Kentucky-specific information. And that information will support policy changes that can be adopted in other Kentucky communities and eventually, we hope, statewide. These local policy changes are critical in launching and strengthening coalitions, demonstrating what works, and building public support. These are essential building blocks for statewide policy change to improve public health. I've shared just 3 examples of the Foundation's work to contribute to these building blocks in public health policy. But we are one of the very few foundations that work in this space in the entire country. My personal goal is to encourage more public health foundations to focus on policy advocacy. Because again, that's how you punch above your weight. That's how we can make major generational changes in public health. And let me just share a statistic with you. In 2016, the top 8 lobby groups by sector invested $198 million in state and federal political candidates. But investment in candidates on behalf of consumers was almost nothing. Now, most nonprofits cannot support political candidates. Still, I would note that the top 5 industries in terms of lobbying expenditures invested $2.3 billion in policy advocacy in 2018. $2.3 billion. My point is, these groups are advocating for policies that affect health on behalf of their own interests. If they think it's important, I think public health professionals ought to think it's important as well. We aren't investing hardly anything on the other side to oppose those special interest efforts. It's no wonder we're unhealthy. No wonder our country's unhealthy. And ladies and gentlemen, this is where the rubber meets the road. I encourage you to consider that as you complete your public health studies at the University of Kentucky. Because the biggest impact that most of us can have on public health in our lifetimes is by helping our communities, our state, our federal government adopt policies that are known to improve health. There is no higher calling than trying to improve the health of your fellow man. Because if you don't have your health, it doesn't matter what else you do have. Thank you.
Thank you, Ben. I'm Julia Kostic. I'm the president of the University of Kentucky chapter of Delta Omega, the Public Health Honorary, National Public Health Honorary. And on behalf of our members, thank you.
Get that out of your way.
Okay. Thank you.
Thanks, Judy.
Okay. So I will continue with induction of our new Delta Omega members with Jennifer Edwards Able assistance here. Last year, for the first time, we were able to induct undergraduate members as associate members of Delta Omega, and we have 10 this year, a couple of whom I actually know. And so we'll start with the undergrads and then proceed to the graduate students and the faculty inductees, and finally the alumni inductee, who is actually not here. So undergraduate student inductees, Ansley McElroy. Morgan Avery. Shelby Rutledge. Michael Regard. Honor McDaniel. Leovarda Emanowski Nunez. Nicole Martin. Addison Lichtveld. Caitlin Short. And Whitney Smith. If all the undergrads will assemble back in the corner there. We'll have some picture opportunities here. Now, the graduate student inductees, this is an award that is only granted to one inductee per department and one from the PhD program. So the first graduate student inductee is Fei Tong Lei. I'm not sure. I think she has moved out of state. Second, Deborah Adekunle. Katie Cornell. Catherine Youngin, known to everybody as Katie. Juan Zhang. And Hong Lu. There she is. And due to a clerical error, Hong's certificate hasn't actually arrived yet, but it should be here this afternoon. So, faculty inductees. It's always a challenge because we have lots of faculty who are inducted into Delta Omega at other institutions, but not these. So, Dr. Teresa Waters. Dr. James Norton. Dr. James Keck. And Dr. Philip Westgate. And we started out with 2 alumni inductees, but it turned out that one of them was already a member of Delta Omega. The remaining one is Dr. William Mays, who is not able to join us, who is a faculty member at another school of public health. And let's have a round of applause for all of our inductees.
Good afternoon. I'm Martha Riddell, and I am the Program Director for the Masters of Health Administration program. And today I get to introduce those who are the new members of Upsilon Phi Delta. As you may see, many of our students actually work as a part of their degree experience, but we do have a couple of our inductees here today that I want to mention. Otherwise, please look at the program for the complete list of our inductees. Upsilon Phi Delta is an honorary that recognizes excellence in health administration. It comes from 3 Greek words that mean health, care, and leadership, and certainly those are 3 important characteristics of any successful healthcare leader. Today, we're going to recognize the students who meet the national criteria for this honorary, which is a 3.5 GPA throughout their career. Upsilon Phi Delta rewards, recognizes, and encourages excellence in healthcare administration. So I would like to ask Lucas Brooks and Laren Collins to come up and receive their certificate. Let's recognize them, please. So please review the list in the reception folder and encourage and congratulate those students who weren't able to attend. Thank you very much.
Good afternoon. I'm Sarah Seprak. I'm the director of the undergraduate program here at CPH. And it's my honor to recognize our BPH Student Award winners today. The Undergraduate Research Award is given to 2 senior undergraduate students whose research activities demonstrated the potential to make an impact in the area of public health research. The first award winner goes to Yasmin Jackson. Yasmin, who unfortunately could not be here with us today, is a fall 2018 graduate. She worked on research with Dr. Corinne Williams for 2 semesters during her undergraduate career. During that time, she worked to develop her own research project, and she presented at CPH Research Day in spring 2018. Throughout that project, Yasmin demonstrated significant growth as a student and shows excellent potential as a future researcher. The second undergraduate research award goes to John Dutton. John is currently working on 2 research projects with the Rural Cancer Prevention Center under Tom Collins. In both of these studies, which have implications for policy change regarding translation into practice, John is responsible for data management and assisting with data analysis. Additionally, John has participated in grant writing processes, protocol development phase for a proposed research study with linkages to reproductive health services and medically assisted treatment for reproductive age women with opioid use disorder. Congratulations. Our next award is the Undergraduate Leadership Award, which is given to 2 senior undergraduate students who excelled in leadership during their time in our program. The first award goes to Krista Meekins. Krista has worked throughout her undergraduate career to be a leader both on and off the University of Kentucky's campus. She was a Fusion site leader, worked as an academic tutor with the Center for Academic Resources and Enrichment, and interned at the Indale Hospital in South Africa. She volunteered her time with multiple groups, including Relay for Life, March of Dimes, the Ronald McDonald House, Shoulder to Shoulder, and Blessing Bags for the Homeless. Her commitment to helping others through service leadership is well documented with her time in the BPH program, and we're thrilled to honor her leadership today. Our second undergraduate leadership award goes to Michael Regard. Michael is a University of Kentucky Gaines Fellow, Chelgren Fellow, and Singletary Scholar. He is a member of the UK Student Government Association and the director of the Government Relations for Beta Theta Phi. He worked as a United States Senate page in 2014 and 16. He tutors for the Carnegie Center and is an intern with the Coalition for Public Safety. We appreciate all he has done to demonstrate leadership both on campus and beyond. Finally, our Outstanding BPH Student Award is given to 2 senior undergraduate students to honor their overall excellence in the program. The first recipient of this year's award is Honor McDaniel. From the moment Honor stepped onto UK's campus, she has embodied excellence. She consistently earned top grades, maintaining a 3.95 GPA. She's been actively engaged in volunteer and leadership opportunities with the university, the college, and beyond. During her time as a BPH student, she was a CPH ambassador and a member of the Dean's Student Advisory Council. She was also an active member of her sorority and a volunteer for Pause for Ability. She held positions with the Tennessee Department of Health and AmeriCorps. And during her time on campus, she was also active in undergraduate research, presenting her own research at both local and national conferences, as well as for the University of Kentucky's Board of Trustees. We're proud to honor Honor today. And then our second Outstanding BPH Student Award goes to Morgan Avery. Morgan has consistently excelled in all aspects of her undergraduate career. She earned top grades, maintaining a 4.0 GPA. She will graduate with a Bachelor of Public Health, a minor in biology, and a certificate in health communication. She is also a member of our first cohort of accelerated degree students and will complete her MPH in May 2020. As an undergraduate student, she has completed research experiences in 2 departments, presenting at local and national conferences in maternal and child health and gerontology. She's an active member of her sorority and was vice president of both the Pre-Physician's Assistant Club and the UK Women's Rugby team. She has also found time to work as a nurse's aide at a residential summer camp for children with disabilities and to complete an internship as a midwife in Ghana. We are proud to honor Morgan as a graduate of our program.
I'm honored to share 3 awardees from the MHA program. Our awards are for the Outstanding First Year Student, the Outstanding Second Year Student, and the MHA Leadership Award. The Outstanding First Year Student goes to Kristen Sikora. Kristen is actually working in the emergency room today, and so she is not here to be with us. But Kristen is an excellent student. She has been very active in the program. She just recently was a member of a case competition team at Ohio State University. She's a student member of the American College of Healthcare Executives, was a student proctor at ACHE Congress, and will be doing an internship this summer at Norton Healthcare. So we're very pleased to recognize her. For our outstanding second year student, I'd like to call Lucas Brooks to receive his award. Lucas has a stellar academic record and has also been very, very active in his days in our program. He is the Student Association President for the MHA Student Association. He serves as a student member of the ACHE Board. He's attended ACHE Congress both years, and he did his internship last year with Appalachian Regional Healthcare and has continued to work there throughout this year. He has been very, very supportive and influential with the Student Association, and we appreciate his leadership very much. This summer, he will be going to the University of North Carolina at their Caldwell Memorial Hospital for a fellowship there beginning this summer. So please congratulate Lucas Brooks. And for our MHA Leadership Award, I'd like to recognize Laren Collins. About a year ago, Laren was elected the recruitment chair for the MHA Student Association, and I think since that time he's talked to dozens and probably hundreds of students about the program, about the community, about living in Lexington, and has been a true advocate of the MHA program. He completed his internship at the University of Cincinnati Health, has an excellent academic record, and will be going to the Medical University of South Carolina this summer for his administrative fellowship. He's been a very active and supportive member of our program. So let's recognize Laren Collins.
Good afternoon. My name is Sarah Wackerbarth, and I'm the Director of Graduate Studies for the Masters of Public Health program. I'm honored to recognize the outstanding MPH students here today. As I call your name, please step forward to receive your award. The concentration awards are given to students in each department's concentration that has stood out during their time in their program. The purpose of this award is to recognize our outstanding students in each of our concentrations. The first MPH concentration award is for an outstanding student in biostats. The biostats concentration award goes to Ms. Fei-Tang Li, who is away in China right now, but she'll be returning to us in the fall to start her PhD program in epidemiology and biostats. She completed her bachelor's in radiation medicine and was enrolled as a biostats concentrator. So acknowledge her. The next MPH Concentration Award is for an outstanding student in epidemiology. The Epidemiology Concentration Award goes to Courtney Marshall. Courtney is consistently a top performer in class and holds a 4.0 GPA. She stands out as a leader in all her courses and is dedicated to public health. She has continually been engaged in community public health and environmental health projects in rural Kentucky. She's an excellent student and mentor to her fellow students. The next concentration award goes for an outstanding student in health behavior. The Health Behavior Concentration Award goes to Katie Cornell. Katie's engaged in all aspects of academics and the health behavior in society. She was the recipient of the KPHA Theodore Ted Hanekamp Memorial Scholarship awarded to a graduate student who exemplifies the scholarship in public service. Along with service and involvement over campus and public community, she's maintained a 4.0 grade point average. The next concentration award is for an outstanding student in health management and policy, and this award goes to Ashwin Kirshna. Ashwin received his medical degree from the University of Tennessee and completed a fellowship in pediatric critical care medicine at Vanderbilt. He's board certified in American Board of Pediatrics, and he currently serves as the PICU Director of Respiratory Care, and we're glad he was able to join us this afternoon. The next concentration award is for Outstanding Student in Preventative Medicine and Environmental Health, and that award goes to Paul Bellamy. Paul is a leader in his field and an exceptional student, though his humble demeanor may not reveal this. He was motivated to develop an independent research project for his capstone, which he led completely from IRB approval to grant submission, all the way to the field, research, and evaluation. We cannot imagine a better example of research and academic ability in an MPH student. And now we move to the 3 overall MPH awards. The first one is the MPH Promising Practitioner Award, and this goes to a student who shows the most potential to impact the future of public health through public health practice. This year's recipient is Chelsea Reed. Chelsea has embraced the MPH curriculum and using what she's learned to apply it to public health practice. She's currently serving as the interim director of the Violent Intervention and Prevention Center on campus. In this role, she provides violence prevention training and helps helped revise the assessment and data collection to better evaluate the service. The second award is the Richard R. Clayton MPH Promising Investigator Award, and it's given to an MPH student who exemplifies tremendous potential as a researcher. This award goes to Paul Bellamy. Paul's unique and creative research on alpha-gal and the occupational risks in Kentucky forestry workers is already making the news. He's an expert in the field of vector-borne diseases, where his research findings have made for significant insights on infectious disease epidemiology. We're proud to say that his work has had significant impacts on the world of public health. Oops. And the last award is the MPH Academic Excellence Award, and it's given to the Masters of Public Health student who exhibits the greatest academic performance throughout the program. This year's recipient is Miss Karina Nance. Karina consistently stands out among the top students in every class, according to the faculty, and has also explored various opportunities to work in the field of public health outside of the college. Not to mention all the good work she's done at Kiprick and now working with Dr. Waters. She has excellent potential to exceed and has submitted her capstone on weight loss interventions in the military to be published. She's an overall outstanding student in all areas of academic program. Thank you.
Good afternoon. I'm Dr. Erin Abner, the director of the Doctor of the Public Health Program. I have the pleasure of announcing our outstanding doctoral student. The award for outstanding doctoral student in the DRPH program is given to a student who exemplifies the highest qualities as a Doctor of Public Health student and will have the greatest potential to be a leader in the public health professional community. As I call your name, please step forward to receive your award. This year's recipient is Xuan Zhang. In addition to her excellent grades in her DRPH courses, Xuan embraced every opportunity to contribute to the university that came her way. She maintained a high GPA, published papers based on her work at Sanders Brown Center on Aging, attended local and national scientific meetings where she presented her research, participated in community outreach events, and she graduated in 3 years. She also loves to dance, and she participated as an investigator in a study of tango lessons as an intervention for Parkinson's disease, which took place at Emory University, and she was an officer in the UK Student Dance Club. After Xuan completed her DRPH degree in December, she took a position at the Johns Hopkins Center for Innovative Care in Aging as a research data analyst. Congratulations to Xuan.
Good afternoon, everybody. I'm Steve Browning. I'm the Director of Graduate Studies for the PhD in Epidemiology and Biostatistics program. First, I want to address a question I know that's on a lot of your minds out there about who actually tied my tie for me this morning. Even an old dog that watches a YouTube video for about 5 minutes can figure out how to do this. So, one other thing I just want to let you know, this is a special time for us in the PhD program. We're 10 years into the program. We're celebrating our 10th anniversary. We've had 25 PhD graduates from the program at this time, and in the recent 2 semesters, 5 people. So actually, kind of competition for this award that I'll be announcing today was pretty stiff. The Outstanding PhD Student Award honors excellence in graduating PhD students in epidemiology and biostatistics. The individual chosen for this award showcases outstanding academic performance in combination with a great research project. Asking a person, please step forward. This year's outstanding PhD student is Hong Liu. Hong was actually nominated by many of our faculty for her work using prescription drug monitoring data to track the opioid use epidemic. Her project has really been instrumental for a current UK HEAL grant that is going through, and it is being reviewed by the Assistant U.S. Attorney. Perhaps better her dissertation than mine. Dr. Slavova, who recently wrote a letter of recommendation for Hong's, the letter was probably longer than my dissertation. So this is really a very deserving award. Congratulations, Hong.
Hi, everyone. My name is Dr. Teresa Waters, and I'm not nervous at all. I am the Associate Dean for Research for the college, and I am here to recognize the recipients of our Student Research Awards. We recently, on Monday, had our Research Day. Earlier this week, students from across our college presented their research in the 2019 College of Public Health Research Day. For each category, we will honor 1 undergraduate, 1 master's, and 1 doctoral student. We now want to recognize these outstanding student researchers. As I call your name, please step forward to receive your award. The winners of the Research Day Oral Presentation Awards are Juliana Mehta. Yes? undergraduate student for teenage mothers and breastfeeding. What is the impact of the Kentucky HANDS program? Congratulations. Nathaniel Wilson, master's student for multiple imputation by chained equations to avoid bias in missing data with interactions, a simulation study. Congratulations. And Vera Pravasud. Close enough. Vera is a doctoral student, and her presentation was on sexual risk-taking behaviors among young men who have sex with men in central Kentucky and usage of social networking applications to meet partners. Okay. The winners of the Research Day Poster Presentation Awards are Sarah Jane Robbins, Sarah Jane is an undergraduate student, and her poster was on the effects of trauma on adverse pregnancy outcomes. Congratulations, Sarah. Katie Cornell. Is she here? Yay! Katie is a master's student, and her poster was feasibility, acceptability, and proof of concept of a parenting intervention adapted for delivery in Appalachia. Okay, and our last awardee, Patrick Ward. Patrick is a doctoral student, and his poster presentation was on enhancing timeliness of drug overdose mortality surveillance, a machine learning approach. Thank you.
It's me again. I have the privilege of finishing the student awards and going into the teaching awards. So the first college level award is the Community Service Award. It is given to a student who has demonstrated outstanding service to inner city or rural communities in Kentucky in the area of applied public health or public health research. This year's recipient is Courtney Marshall. Courtney stands out as a leader in all her work, both inside and outside the classroom. She has demonstrated her support and service in rural Kentucky through her research project on HCV in Appalachia. Courtney was also involved in an investigation of water contamination in Martin County. She is currently a trainee with the KRRC? Central Appalachian, I'm not going to get that right, Educational Research Center. There we go. Program and continues to engage in rural community service. The next award is the Howard Boast Award, which is given to a student that has been recognized and nominated by their fellow students. This is a student-nominated award for a fellow student. The Howard Boast Award is given annually to a student concentrating in health management and policy who, through scholarship, service, and leadership, has made the greatest contribution to the welfare and success of fellow students and the College of Public Health. Our recipient this year is Dakota Halbert. Words cannot express how crucial Dakota has become to the success of the college and the Health Management Policy Department. His ability to work with faculty on research and as a student support worker, helping Dr. Riddell, Dr. Kostic, Dr. Wackerbarth, and Dr. Waters in many ways to further the goals of the Health Management Policy Department. Dakota has also truly helped shape the current landscape of the college by encouraging student engagement in UK healthcare, SPHA, and other student groups. CCTS Research Day presentations, National Public Health Week events, and the CPH Ambassador Program. Dakota is a consistent cheerleader for his fellow students. His passion for public health is evident in his support for his HMP colleagues and the college as a whole. The next award is the John Wiggs Golden Rule Award. This award is given in memory of the college's first Associate Dean for Admissions and Student Affairs. The Golden Rule is given to the MPH or DRPH student who embodies the empathy, selflessness, and reciprocity of the Golden Rule. The student receiving the award should have exceeded every expectation of their degree, program, as well as service and leadership within and outside the College of Public Health. This year's winner of the Golden Rule Award is Katie Cornell. Sorry. Thought she was rolling her eyes at me there for a minute. That's not what she was doing. She was looking behind me. Katie's level of performance and engagement in the MPH program has been unparalleled. She has contributed to the development of the Bourbon County Health Department's Syringe Exchange Program and developed an overdose education training program manual for Talbert House in Cincinnati. Katie also served as CPH representative to the Graduate Student Congress for 2 years, presented research findings at the Kentucky Public Health Association and the American Public Health Association annual meetings, as well as at CPH Research Day, as you all were aware of that, and won first place with her team in the 2019 UK Global Health Case Competition, moving on to represent UK at the International Global Health Case Competition at Emory. She is a leader with a heart for public health. The next part is we will recognize all of our students that are working with the Student Association and our College Ambassador Program. First, we will I will honor our graduating College of Public Health student ambassadors who have played an important role in recruitment and representing the college at various events across the state and out of state. Please stand as your name is called and remain standing. Following the recognition, they want a picture, so please move to the backdrop when I call your name. Our graduating ambassadors are Zainab Al-Abdali, she's here. She's here. Lucas Brooks, Laren Collins, Dakota Halbert, and Alex Miller. Yes, you have to have a picture taken. Go. We also want to thank them for all they've done. They have gone to a lot of events and represented the college very well at all of them. So next would be, am I supposed to do the MHA? The MHA Student Association officers. These are officers were elected by their peers, and they have provided also invaluable service to the Masters of Health Administration. Y'all just might as well stay over there, some of you. Lucas Brooks is president. Cameron Hyde is vice president. Laren Collins was recruitment chair. Andrew Horn was treasurer. And Olivia Colliver was secretary. And for the Student Public Health Association officers, they were also chosen by their peers and have provided additional lots of service to the college. Peyton Malone, president. Alexandra Miller is vice president. Manasa Mantinkanti, did I get that right? Secretary. And Brendan Matthews was treasurer. I think Peyton must be the only one here. She's next on the list. Guess I should tell you why. Peyton, as Student Public Health Association president, is here to give the Golden Apple Award.
So, this year's recipient of the Golden Apple Award is described by her own students as someone who consistently goes above and beyond for her students. Not only does she make a measurement class fun, apparently, on a Monday morning, she will always make time to work with students, ensuring that they leave understanding all of the content. In addition to being an exceptional educator, she is always there to lend a helpful ear and guidance for students navigating life in general. We are pleased to award this year's Golden Apple Award for Exemplary Faculty, Dr. Christina Stutz.
You don't need that anymore? All right. She was shocked. I told her she had to be here, but she had no idea why I told her she had to be here. So she's, of course, rolling her eyes at me again while she's sitting there looking at me. In an effort to reward faculty members for outstanding teaching efforts and to recognize innovation in the classroom, learning, and subject matter delivery, the dean has established 2 annual teaching awards. One is the Dean's Innovation in Teaching Award and the Dean's Outstanding Teaching Performance Award. The recipients of these awards were nominated by their colleagues and chosen by a selection committee of their peers. The first award is the Dean's Innovation in Teaching Award, and it recognizes notable efforts to enhance teaching courses through non-traditional methods of instruction, such as distributed education, utilization of course management software, or an executive learning format. The award is also intended to acknowledge teaching that extends beyond the scope of the Lexington classroom to that which provides the capability to include students from other programs and locations. This year's recipient of the Innovation in Teaching Award is Dr. Erin Abner. Her nominator writes, in 2014, when Dr. Abner realized the unmet need for a course in causal inference for epidemiology and biostatistic graduate students, she undertook a program of self-directed reading, workshops, and short courses to learn how to teach this critical topic. Her work resulted in the development of the course CPH 718, Special Topics in Epidemiology, Introduction to Causal Inference. First offered in the fall of 18, her students also appreciate her dedication. As one writes, Dr. Abner is so thoughtful and precise in her presentation of the material. She is the epitome of an outstanding instructor. The second award is the Dean's Outstanding Teaching Performance Award. This award recognizes efforts to improve teaching and maintaining the highest levels of student learning through course revisions, engaging student activities, and other effective approaches to the teaching of courses. This includes initiatives or instructional approaches that resulted in improved learning outcomes and/or a positive impact on student learning demonstrated by above average course evaluations, as well as comments from students. Let's not forget that. This year we have 2 recipients of the Outstanding Teaching Award. For excellence in undergraduate teaching, I would like to recognize Professor Jennifer Daddiesman. Her nominator writes, Ms. Daddiesman is an incredible teacher. She does not write a syllabus or construct a course, she designs curriculum. Evaluating each course element to elevate student learning, she is a scientist, and her love for the science of teaching is evident in her outstanding performance as a teacher. I am honored to nominate her for this award and to have her as a colleague. For excellence in graduate teaching, I would like to recognize Dr. Sarah Wackerbarth. Dr. Wackerbarth's nominator writes, her passion, enthusiasm, and creativity have been a tremendous benefit to our students. She is dearly loved by students who seek her advice long after their departure from campus. Her commitment to the students is unparalleled. She is well deserving of this award. I've decided I like this position because I get to watch the faces when you don't know it's coming. It's really a lot of fun. That concludes our ceremony. On behalf of the College of Public Health, I want to once congratulate all of the awardees and honorees today. We are very proud of our students and faculty, and I would like to recognize all of the staff in the SEAS department that put together this wonderful program today. So thank you and have a wonderful afternoon.